limited government, and that's it. That's it. Look, we all know, even Democrats in Washington know, Obama was never ready to be president. He's not. He never did anything. Of course he wasn't ready to be president, but that's not the problem. The problem is the Republican Party really lost its way. And it made it so easy for him, because if Obama and the Democrats want to get everybody dependent upon government because they want to get reelected, you know, Republicans have been doing too much of that too. And you can't blame people for being confused. You can't blame people for saying, now wait a minute, who stands up for me? I started a small business. My God, that's my business. I want to keep what I make. I want to be able to hire people. Government, get out of my way. Who's talking for that person in Washington? Or who's talking for this person? I'm a Catholic priest. I run a hospital. You mean to tell me, Tammy Duckworth, that we're at a point in this country where my government can force a Catholic priest to pay for something or provide something that goes against his basic faith? You mean to tell me we're at that point in this country? Hell no, we're not! Tammy Duckworth, what about a guy who's got a small business in Elk Grove Village? Small manufacturing plant, 150 employees. He's a practicing Catholic. What if he does not want to have to pay for a health care plan that goes against his religious beliefs? Do you understand the dangerous road we open when we give up our lives to government? It needs to be stopped. It needs to be stopped. Hey, let the record show I've only had a half a cup of coffee.
Hey, Joe. I'm a family practice doctor up north. And I can piggyback off of what Joe just said as it applies to the physician delivering health care. My biggest concern is that my government can make the Catholic Church do what is morally objectionable. I can guarantee you they can make Dr. Ray Bianchi do it as well. And that is my biggest concern. So what Joe says, we have to have the responsibility for our health care. I couldn't believe it more. Because if we give it to the government, it'll come down to dollars, and only dollars. Just last week, I had a 90-year-old lady living in a nursing home who still talks to her family, communicates with them, but is demented, broke her hip, and it was recommended, why don't we just not fix it? Now, the reality is people don't understand, if you don't fix it, she will die, get bed sores, have a miserable several months. She was very much high risk. But we proceeded with surgery, God willing, it worked out. But I can guarantee you, the government will come on me hard one day and say you have no business authorizing fixing that hip. And if any of you ever came to my office with a broken arm, broken limb, wouldn't I stabilize you? To care for you? Wouldn't that be the most humane thing? I do that for my dog. So that we cannot give the government the power to decide what happens to you. That belongs to you and me, your doctor. Period.
When we were talking about
A little closer.
when we were talking about Medicaid before, okay, if you can't afford insurance, you're supposed to have Medicaid. Well, in Illinois, there's only 3 ways, 3 conditions to meet to be on Medicaid. Being poor is not one of them. And didn't the court just say the states do not have to change their Medicaid laws?
Yes.
So what happens now?
Good question. Hold on. You know, again, the Supreme, it actually in some ways was a very good ruling. They basically, the Supreme Court put a fence around the Commerce Clause. Basically said the government can't use their regulatory power to compel Americans to do something. And the government also, for the first time, slapped down a federal spending law and said you can't use Medicaid dollars to coerce states into cooperating. And that's going to open up huge problems because, remember, the name of the game is everybody's going to be thrown out of Medicaid rolls. Well, what if states don't want to take them? Who's going to assume that burden? It's going to be thrown right back at the federal government. So I ask you, who's going to assume that tax burden? No, probably your kids and your grandkids. Just going to keep piling up. Anybody way back there, John? Who's got a hand up? Right? Quickly.
I want to address the doctor for a minute. Isn't there some way you can come back at the government? Because by not treating that lady, you are violating your Hippocratic oath. That is doing harm. You have taken an oath to do no harm.
Do you want to respond up here? Come on, John, Mike. You're getting a workout today. Everybody, John Karras.
But I think you have to be realistic. I guarantee you that Catholic priest is violating an oath that he has. But what will happen was the government will put his institution out of business, and they will put my institution out of business. You can claim foul all you want. I will be penalized to a point where I can't survive. Remember, in Nazi Germany, when the Jews were terminated, it was doctors who terminated them. So you ask, well, where were the good doctors? They were terminated. Now, I will not be terminated with a bullet, but I will be financially put under. And only the docs left were the ones who were willing to play the game. And that's what you have to recognize. That's what's happening here. It's how all socialistic nations start. They start by taking your health care.
Thank you.
Congressman, just clarify for me what you had said a moment earlier. I'm born 1965, and my family came from an Asian country. We're U.S. citizens. My mother is a retired staff pharmacist for the VA hospital. Did you say earlier that the goal is to get Medicare patients to Medicaid? Is that what you said earlier?
The goal is going to be to push everybody onto the Medicaid roll. To fund Obamacare, they're cutting Medicare to a large tune of $500 billion. It's going to only go up from there. They're going to knock people off of Medicare Advantage. They're going to get rid of Medicare Advantage, put those folks on Medicare, and then eventually just move everybody to Medicaid. By the way, to my veterans, Obama's proposing to do the same thing with veterans. Look at what he did in his budget. Look at the whack he took to TRICARE. What he's trying to do is basically get rid of TRICARE and move all of those folks onto Medicaid. The goal, guys, we're done being complicated. To answer your question, this is a first big step toward single-payer, government-run health care. Obamacare, in Obama's eyes, and Duckworth's eyes, and Pelosi's eyes, is to replace Medicare. It will first replace Medicare Advantage, and then it will replace Medicare. It'll force seniors onto, I'll tell you something. I'm getting awful tired of people saying we got a war on women and a war on seniors. This health care program is a war on seniors, and all my moms, raise your hands if you're a woman. I love asking that because a lot of people pause. You'd be amazed. I see guys scratching their heads. Moms in the audience. You know, no, put them down. I was just kidding. And here's Tammy Duckworth loves to say, you know, she's been told to say that that Republicans have a war on women. I ask you something, all my females in the room. This just always kills me. The Democratic Party is so demeaning toward women. Think about this. Just think about this one. Okay? All anybody in this country cares about right now is we're not working, the economy's not growing, and we're broke. But for some reason the Democrats think women don't get that, because if we bring up abortion or contraception, it's like women will forget that their house is burning down. The minute you say contraception or abortion, Democrats think women aren't smart enough to remember that their husband's unemployed and their brother's losing his house, and oh my God, we can't pay our bills. All I got to do is mention contraception. I find that so offensive. And I'm not a woman. I find that so offensive. And that's what they're doing. That's what Obama's doing. That's what this guy's doing. That's what Duckworth's doing. All I got to do is say contraception, and for some reason they think women aren't smart enough to remember the house is burning down. Shame on them. Shame on them. Use the mic. There you go.
You've convinced me. I'm not voting for Obama. And I have two daughters. One was raped and one's a lesbian.
Put it a little closer.
I have two daughters. One was raped and one is a lesbian. The lesbian wants to marry her long-term partner for 10 years, and the one who was raped wants to get an abortion. I know what Obama is doing. What is Romney going to be doing about? That's hypothetical, by the way.
No. There's no, because you know me, go ahead and have a seat, I answer everything. I don't want to speak for Romney. Governor Romney's pro-life, and Governor Romney opposes gay marriage. I'll stand before you as a candidate. I'm pro-life without exception, and I oppose gay marriage. And here's the point I'm going to make to you. Hold on. This is the beauty of our system. If those two issues right now mean a heck of a lot more to you than that our country's house is burning down financially, then I'm probably not who you want to vote for. And Mitt Romney's probably not who you want to vote for.
I want to vote for Obama, though.
well, then let's you and have a cup of coffee next week. Again, this is, look, and I don't like it when people say, life is not an important issue, or guns, or gay marriage. Every issue is important. And I'm not going to run from that. Every issue is important. Here's all I know right now. We've got about this much time to set this country on the right financial path, or your kids and your grandkids will never recover. And I don't know, wherever I stand on gay marriage, I'm not going to let that thought get in the way of that. Not this year. Not this year! Not this year! Not this year! Right over, John, right over here. Hey, folks, it's 4:30. Again, I'm going to stick around till about 9:30. But if anybody wants, we'll stick around and keep doing questions for about 15 more minutes. Then I really do have a good 4-minute close. And then I'll stick around and answer anybody's questions. Go ahead, my dear.
Hello, Mr. Walsh. I have a couple of things. One is there's a person in here who dropped his or her keys. They're in my wallet.
Keys. Make sure everybody checks. Make sure you have your keys.
If you identify them, I'll give them back to you. The other point is...
Wait, find out who they're voting for first. Walsh or Duckworth or...
The other point is, I always hear about the national debt, and I always hear people say, well, it doesn't matter. Well, some years ago, when you were a small child, we had a basketball player named Michael Jordan. The last year he played was making $36 million that year. I always hear, well, tax the rich, tax the rich. I'm not one of those people, unfortunately. But if the government took $36 million of Michael Jordan's income for that year and tried to pay down our national debt, It would take 416,666 years to pay that debt off.